Hello and Assalamualaikum, ladies and gentlemen. Welcome to yet another episode of the Dental Talk. We are approaching 50 episodes of the show finally, and today we have a very special guest with us here today. A major chunk of our following is from CMH, FMH, and LMDC. So many people have asked us to get Dr. Abid Asher on the show, and we finally have Dr. Abid Asher with us here today. For those of you who don't know Dr. Abid, Professor Abid Asher has been one of the first few faculty members of FMH College of Dentistry. He's currently serving as the principal of the institute. He brings a wealth of experience from England, the UAE, and Saudi Arabia. He's a graduate of De Montmorency College of Dentistry and specialized from the Royal College of Surgeons, England, attaining FDSRCS and also the membership of the College of Physicians and Surgeons in Health Professional Education. FMH is one of the best institutes for dentistry in Pakistan. He's serving as the professor and head of department of the oral and maxillofacial surgery and the lead faculty for educational research of the MCPS Health Professional Education. I could go on about his research and all of his introduction, but I think we'll just get into the show. And thank you so much, sir, for joining us here today. It means so much to me. कि आपने time निकाला आज. How are you doing?
Alhamdulillah, I'm fine. Thank you very much for such an elaborate introduction, which really I'm not. Okay.
You're being humble. That's not true, because everyone I ask, especially your students, everyone has really great things to say about you, and we'll find more about that during the show. But sir, with your permission, should we start with the questions?
Yeah, sure.
All right, sir. Sir, थोड़ा पीछे जाते हैं टाइम में. Tell us a bit about yourself. Introduction तो मैंने दे दी है. Tell us about, बहुत पीछे जाते हैं. How did you get into dentistry, and how were those first few undergrad की years? How were those like at De Mont so many decades ago?
Yeah. Well, getting into dentistry, of course, I mean, following the path of doing FSC pre-medical, and then had a choice of whether to go into medicine or dentistry. So one of my mentors, my cousin, who is a general surgeon and professor at Ziauddin, he advised me to join dentistry. And initially his comments were that join dentistry, even if you do not become a specialist, you will still be doing a specialist work.
Yeah.
So from there, started with that, leaving MBBS aside, and proceeded with dentistry. With regards to the formative years in the dental college, great time there, great fun there.
Yeah.
Academics were always as the first priority.
Okay.
And those priorities carried on, but nevertheless, we had huge amount of fun during the academic years, and we look back with great fondness about our the class fellows and the fun time and the educational time, and so many laughters back then.
I'm sure that's a brilliant introduction. All right, sir, आपने BDS कर लिया. Then we know you specialized from the Royal College of Surgeons in England. How was that experience for you as a young dentist? As a young dentist, you probably went to the UK, you studied there, you spent time there. सबसे पहले बताएं, why did you specifically choose oral and maxillofacial surgery? And then how was that experience of studying it in the UK?
पहली चीज तो ये कि when we graduated, unfortunately, we did not have any post graduation in Pakistan.
Yes.
Okay, so we did not have any choice but to go abroad.
Yeah, to specialize.
So decided to go abroad for our fellowship. So first step was going there, doing fellowship part 1. My passion from the students' days was orthodontics.
Okay.
The second was endodontics.
Okay.
And oral maxillofacial surgery, it was above prosthodontics.
Okay.
However, as the fate would have it, so lots of things in life are fate driven. Yeah. I mean, this is a message which I wanted to convey.
Yeah.
Like getting to UK, having done the part 1, and options of going for orthodontics would mean that you enroll into a master's in orthodontic program, which leads on to led on to do MOrth at the same time.
Yeah.
However, that would have required, that was a 2 years master's, would have required like good 25,000 pounds a year of investment.
Yeah.
Whereas if we go into fellowship in oral surgery, it was a hospital based. You were working, and while you're working, you were taking the exams. So I was getting like 25,000-30,000 pounds a year.
Yeah.
So effectively, I was left with no choice there.
Yeah.
So as I said,
Makes sense.
lots of things well, man proposes,
God disposes.
Allah, yeah.
Yeah. All right. Perfect. और सर वो experience कैसा था of studying in the UK as an international student because वो आप में से पहली दफ़ा ही गए होंगे बाहर पढ़ने के लिए तो वो भी एक बड़ा different experience होता है. How was that experience for you like and how did you settle in?
Again, it was not like a hardcore academics,
Yeah.
because hardcore academics was doing, like everybody does a FCPS Part 1 exam. So FDS Part 1 was a similar exam to that. So
Yeah.
that preparation was done partly in Pakistan, partly in England,
Yeah.
and then carried on to take the exams and getting through that. After that, it was, work-based
Yeah.
uh, studies. So we were working and we were doing everything which was in the books. So we were doing and studying at the same time.
Yeah.
So, with the hands on thing, you have so much more applied knowledge.
Yeah.
And I think that made things so much worthwhile
Okay.
because you're getting hands on as well as
Makes sense.
doing the studies.
All right. Yeah, that makes sense. After studying and working a while in the UK, you moved to the Middle East and spent some time there. Why did you decide to move to the Middle East for work and as a surgeon?
Uh, Basically, the purpose was to have some financial basis.
Mm-hmm.
So went on initially to UAE. We had like 4 years there, and at that point we were planning to come back, and then got an opportunity to go to Medina Munawwara.
Oh, wow.
Could not refuse that opportunity,
Yeah, obviously.
and went on to stay there for 5 years before coming back to Pakistan.
Before coming back to Pakistan. And Middle East, mein, how was your experience of working with the Arabs?
In UAE and initially in the UAE, because that were more of formative years again after the fellowship.
Absolutely.
I was very lucky that I had colleagues, very, very experienced colleagues. Like I had a professor from Hungary, a brilliant, brilliant surgeon.
Yeah.
So we were working together as colleagues, and he was like, a great mentor and teacher for me. So my surgical expertise and experiences grew in UAE tremendously. And that was more of a registrar position or a specialist position. In Saudi Arabia, I went as a consultant, so there was a much greater exposure working as an independent consultant. Having said that, Saudi Arabia is especially Medina was a great place to go to.
Absolutely.
Spiritual reasons, obviously, first of all.
Yeah.
And experience-wise, I had great experience in trauma
Yeah.
because we had a lot of pilgrimage there. उसमें किसी एक pilgrimage bus का accident होता था तो we would have like
Many
एक ही
cases.
बारी में 10-12 patient आ जाएंगे and then we would get busy. So that was great experience. Having said that, Middle East itself, if you do not have adequate uh, earlier years में अगर अच्छी आपके पास कोई ट्रेनिंग पार्टनर्स नहीं है, कॉलीग्स नहीं है, तो इट्स अ प्रोफेशनल ग्रेवयार्ड. So you earn money, but professionally, progressively, you would continue uh, kind of just spend time really. So that was one of the reasons always had in mind that I have to go back and get settled in Pakistan.
Perfect. So my next question वो भी इसी चीज के बारे में था. What made you come back to Pakistan? Because ये होता है कि once you've moved out, it's very rare that people move back. How difficult was that decision, or was that difficult at all? And यहाँ आपका क्या thought process था about moving back to Pakistan?
Well, there was always a will to come back to Pakistan. ठीक है. अभी भी, if I compare my life, leaving aside the spiritual part in Medina Munawwara, I had a great time in UK, UAE, and Saudi Arabia.
Yeah.
but nothing like practicing profession in Pakistan. Absolutely no match.
Yeah.
With regard to fulfillment,
Yeah.
प्रोफेशनली और अगेन अपने लोगों में अपनी
Yeah.
बात
That's
करते
true.
हुए being the
That's true. I understand.
first rated citizen with
Yeah.
all the shortfalls of the country. This is our country and we can say yes, I'm Pakistani, what is the problem with you, which you
Yeah.
could not say anywhere else.
Yeah.
So
That's.
there's no match to that.
Mm-hmm.
जब मैं यूएई गया तो उस वक्त इनिशियली था कि 2 साल काम करूंगा वापस आ जाऊंगा.
Mm-hmm.
तो उस वक्त वन ऑफ माय फ्रेंड्स टुवर्ड्स द एंड ऑफ द सेकंड ईयर सेड, आबिद यू मस्ट बी पैकिंग अप नाउ. मैंने कहा व्हाई? कहते हैं कि नाउ इट्स गेटिंग टू लाइक 2 years एंड यू सेड यू आर हियर फॉर 2 years. मैंने कहा नहीं, आई एम फर्म विद माय वर्ड्स. आई एम स्टिल सेइंग कि इट्स फॉर 2 years, another 2 years. So
Another.
those another 2 years continue on in UAE and they become decades. So
Yeah.
towards the, well, whenever at the time when I was leaving, it was time for me to leave
Yeah.
because of mainly always had a will to come back.
Makes
Number
sense.
one, number two, the children's education was at such a position that I had to move back. Number three, the parents' health statuses. So
Yeah.
overall, everything kind of worked well for me.
Worked well for you. Perfect, sir. Acha, sir, you moved back, and then I've talked to Dr. Saika as well, and I know that she's told us on the show that she contacted you, and then you guys got together, and then you thought of opening a clinic, right? That's how it went. आपने जब आप move back किया, was it your main goal to start up a clinic, and how did you go about starting up your own practice and building a team?
देखिए, I have worked throughout in the previous 14 years in the West and the Middle East in
Absolutely.
public sector institutions.
Yeah.
Okay, they're all government institutions, so I had not worked in a private institution.
Absolutely.
Dr. Saika, Dr. Amjad, Dr. Syed Abid, Hussain, they were all my contemporaries. Dr. Amjad was my class fellow, and the others were, near my classes. So in the dental college, so we knew each other well from the college times.
Okay.
So I got a call while I was in Saudi Arabia from Dr. Amjad. Here we are opening up a clinic in Lahore,
Mhm.
and we would love to have you. A oral surgery में they wanted. So the timing was perfect for me. I said yes, fine. So it was, I think, Dr. Abed, Dr. Saika, Dr. Amjad, whose brainchild it was.
Mhm.
और उसके बाद से I came, I joined there, joined with them,
Mhm.
and we have developed the practice over the years.
Absolutely.
uh, Again जो practice development में जो surgical part में of course everybody played their own role. जो
Yeah.
भी practice build-up होती है हर clinician के नाम पे उनकी goodwill पे gradually progress करती है. But initial startup and progress में जो role initially Dr. Abid, Dr. Amjad, Dr. Saika इन लोगों का था. हम लोग तो after the college hours we would go and do our patients. So I think a great credit to them.
Yeah.
And of course, we supplemented and contributed as we moved on.
All right. Sir, it's one thing to, you've been working at dental professionals for a while now. So you obviously know how a good dental practice works and आपका experience. It's one thing to build a practice. It's one thing to build सबसे बड़ी dental practice of Lahore. तो how आपने पिछले जो 10-20 सालों में देखा होगा, how did you guys as a team build this practice from ground up और इसको इतना ये जो इस लेवल पे पहुंची है, what's the secret, not the secret but क्या टिप्स एंड ट्रिक्स हैं कि एक प्रैक्टिस को आप बढ़ा सकें एज अ टीम?
देखिए बहुत सारे फैक्टर्स हैं.
एब्सोल्युटली.
एक तो आपका सेटअप इटसेल्फ is one factor. So we started off with a state of the art setup. So that, and again the location was such that everybody would notice the place. That is the start. Having started, then end of the day, unless you're competent,
Yeah.
patient will not come to you again.
Yeah, that's true.
Okay. So I think the baseline is कि आपकी जो competency कैसी है. Competency in terms of the clinical skills, as well as your social skills,
Yeah.
especially the communication skills.
Communication skills.
ठीक
Yeah.
है, how you speak to the patient, how comfortable you make the patient. एक तो एम्बियंस और सेटअप का है, लेकिन जो वर्बल जो आप उनसे कम्युनिकेट करते हैं ना, कम्युनिकेशन स्किल्स
Yeah.
is such a huge factor which is so
Absolutely.
underrated. So, like I tell all my students all the time, when you first meet the patient, the ways you say assalamu alaikum, kaise hain aap,
Yeah.
you know,
Yeah.
that is an icebreaker. That one simple, you know, the warmth, and you show how, okay, you care for the
That
patient.
is so true. Yes.
It should, patient should feel it. It
Yeah.
should, there should not just be words to
Yeah.
their ears.
Yeah.
ठीक है, तो वो चीज and that feeling of care
Yeah.
by the patient,
Yeah.
and based on solid skill set is important. So
Absolutely.
दोनों चीजें, अगर मेरे जो कम्युनिकेशन स्किल्स बहुत अच्छी हैं, मैं उनसे बड़ी अच्छी बातें करता हूँ, और मेरा स्किल लेवल अच्छा नहीं है, तो
Mm.
एक बारी बेवकूफ बन जाएगा पेशेंट, दूसरी बारी भी बन जाएगा, कितनी देर बनाएंगे हम?
Yeah. Makes sense. All right, sir.
राइट.
Sir, your that is brilliant advice, sir. Sir, आपने उसके बाद you've also joined FMH and you were one of the first faculties to join at FMH. Now you're the principal and the head of department. How has your experience been working and building such a renowned dental institute of the country? ठीक है, क्योंकि आप you've been शुरू से आप almost साथ होंगे FMH के, तो how has that experience been of working at such a esteemed dental institute और उसको grow करना to the level that it is at now? How has that experience been for you?
Yes, I joined FMH in the formative years of dental college,
Yeah.
और हमारे पास सेकेंड ईयर आई थी
Mhm.
व्हेन आई ज्वाइंड इन, और मुझसे पहले जो करंट फैकल्टी में एक डॉक्टर नसीर हैं, हमारे ऑर्थोडोंटिस्ट, हु वाज हियर,
Nasir,
और
absolutely. He's
जो
also my
डेंटिस्ट्री की
orthodontist. He's also my
राइट,
yeah. When I was
राइट,
12.
सो डॉक्टर, हाँ, तो डॉक्टर नसीर वाज हियर बिफोर मी, और उसके बाद बाकी लोग मेरे हमारे ऐसा ऐसा ज्वाइन करते चले गए.
Yeah.
And again, I mean, Major General Noor Hussain
Yeah.
was there as head of the dental section at that time, or so they were the founding few people. I joined in. We were in formative years. Clinical training start nahi hui thi, or I think the strength of FMH is that we started off small.
Yeah. Okay.
We initially had 25 students,
Okay.
okay, for a good many years,
Yeah.
okay, for the first like 7 years.
Oh
वो
wow.
25 students के साथ we kind of, you know, there was a very you can say one-to-one and personalized training of the students. ठीक है,
Absolutely.
हर डिपार्टमेंट में रोटेशन में 5 6 7
Yeah.
स्टूडेंट्स हैं, और उनके साथ बड़ा ही हम लोगों का पर्सनल किस्म की टच होती थी, और टीचिंग ट्रेनिंग दोनों में वी वुड हैव यू नो अ ग्रेट टीचर स्टूडेंट रिलेशनशिप. तो
Absolutely.
और उसमें जो हम लोगों ने टीचिंग को भी अपना यू नो फ्लरिश किया, और ट्रेनिंग को ग्रेजुअली जो हमारे प्रोसेसेस वर पुट इन प्लेस. So I think that was a good building block for us. So 25 say we went on to 50 for about another 6 years before we went on to 75. So the gradual build up tha, so it helped us,
Yeah.
you can say, give the finishing touches to our training program itself.
Yeah.
And as we proceeded on to, मतलब कि, while we had 50 students, we moved on to become a postgraduate center.
Yeah.
So ours was the first place jahan we had postgraduate trainees from in all the 5 clinical specialties across Pakistan. There was no other institution.
That's exact. That
Uh,
was my next question. That was a very
yeah,
that's a very big deal. के सारे 5 institutes में especially Perio. I feel like I think Perio was first training Perio की FMH.
yeah, started in at FMH.
Yeah.
लेकिन जब हमारे पास जो कि हमारे जो पोस्ट ग्रेजुएट ट्रेनिंग जब स्टार्ट होती है, So it gives a great boost to undergrad training as well.
Absolutely.
The quality of undergrad training increases tremendously. And then we had a policy that our postgraduate trainees will also be demonstrators.
Oh, okay.
Unfortunately, demonstrators अगर लॉन्ग टर्म पे डेमोन्स्ट्रेटर्स हैं तो उनकी इंटरेस्ट इनिशियल ईयर्स में तो रहती है, फिर बड़ा मुश्किल हो जाता है फॉर दैट टू बी मेंटेन्ड.
Yeah,
डे इन डे आउट यू आर डूइंग द सेम थिंग.
yeah.
लेकिन पोस्ट ग्रेजुएट ट्रेनीज दे कम फॉर अ 4 year period. They have selected and joined a specialty, and the specialty they have chosen, they are in it for lifetime. So
Yes,
they
sir.
have that extra special interest. So
Yeah.
for learning.
And
So
sir, if they're a demo, so they can also take lectures as well.
ठीक है, because they are demonstrators, they're training the undergrad, so quality of training increases tremendously. So
Yeah.
that was, I think, a very important factor as well.
Absolutely. ये FMH की post graduate training is definitely one of the best in Pakistan, and ये whenever I talk to any of my seniors, they always mention FMH का post graduate training every time. Sir, इसी तरह we'll talk a bit about research. Undergraduate years में over the years I've seen, मेरी तो खैर बहुत कम एक्सपीरियंस है, आपने भी देखा, आपने खुद देखा होगा कि अंडरग्रेजुएट में रिसर्च कल्चर आहिस्ता आहिस्ता स्लोली बट स्टेडली बढ़ रहा है. सर, इस रिसर्च कल्चर को इंक्रीज कैसे किया जा सकता है अक्रॉस द बोर्ड, अक्रॉस इंस्टीट्यूशंस के रिसर्च कल्चर अमंग अंडर पोस्ट ग्रेजुएट ट्रेनिंग्स को तो करनी पड़ती है, बट अंडर ग्रेजुएट में वो रिसर्च कल्चर इंक्रीज हो, वो कैसे एक इंफ्रास्ट्रक्चर बेटर किया जा सकता है आपके ओपिनियन में?
Again, first and foremost is for us to understand
यस सर.
why do we have to introduce research in the undergrad.
ओके.
ठीक है. जो कि अंडरग्रेड के हमारे स्टूडेंट्स हैं, बेसिकली दे आर हियर फॉर being trained as good dentists. ठीक है, a good, knowledgeable, skillful dentist with the right attitudes. So the focus have to be a good, knowledgeable, skillful dentist. Now, हमारा जो BDS जो करा रहे हैं, हमारा एम है कि उनको हमने एक अच्छा जनरल डेंटिस्ट बनाना है.
ओके.
However, there are several career pathways after graduation,
Yep.
which includes being a general dentist,
Yeah.
being a specialist dentist,
Yeah.
going into teaching, going into research, and then going into maybe hospital administration, and becoming an entrepreneur and moving on. Okay. So, uske liye, to me, one of the most important reason for research to be introduced is not for them to become a researcher,
Yeah.
but to give them a taste of what research is like.
ओके. मेक
ठीक
सेंस.
है. और वो उन्होंने आगे जाके as they move on, then they can choose के they want to take pursue a research based career or a clinical based career or specialist career, etc.
वाह.
एक तो ये वजह हो गई. दूसरी वजह ये होगी, विच एवर फील्ड यू टेक, आजकल के जितने भी यंग ग्रेजुएट्स हैं, because things in any profession is changing so fast because of the technological advancements. ठीक है, technology is moving at such a rapid pace, it's very difficult to keep up with it. And the only way to keep up with it, to become a lifelong learner.
Yeah.
Okay. And how do you become a lifelong learner? Basically, to make sure that you are, updated with current literature.
Up to date with
And how do you develop a skill to be updated with current literature? Is to read the literature,
yeah.
ठीक है, critically and understand it.
Yeah.
And how best to proceed with this is when you go through a process of research, जिसमें initially you do the literature review, you critically review articles, उसमें से जिस निकालोगे, you will understand उसका असल मकसद क्या है, उसके applied forms को लेके whatever is relevant you pick up. So that is the skill which you develop out of research.
Makes
So
sense.
that is first and foremost thing कि हम लोग the purpose of research को clearly understand करें. हम लोगों को we should not get swayed कि जी research is the primary task.
Yeah.
Primary task is to become a good general dentist.
Perfect, sir.
ठीक है, skills की कोई
वो ना हो।
आपकी कोई और चीज है ही नहीं उसके मुकाबले में.
ठीक है सर, मेक
Because end of the day, dentistry is a skill intensive profession. It's about what you can do with your hands is what matters. ठीक है. अब having said that, तो research में जो हमें problems आती रही over the years, we would have students who were interested in research. Why interested in research? Because career opportunities में research papers देखे जाते हैं, बाहर के एडमिशन में देखे जाते हैं, रिसर्च प्रोग्राम्स में देखे जाते हैं. एंड उसमें हम लोगों के पास स्टूडेंट्स आते थे, दे वुड डू अपॉर्चुनिस्टिक रिसर्चेस. तो उसके लिहाज से वी वर ऑलवेज इट वाज अ काइंड ऑफ अ फ्रस्ट्रेशन के हम लोगों का, क्योंकि एक पूरा कोई सेट मैकेनिज्म नहीं था. तो वो ओकेजनल किसी ने किसी को पैट्रनेज में ले लिया तो वो कर लेते थे.
Makes sense.
End of the day, if a level of understanding of research is mandatory, तो उसके लिए एक structured program for research should be there.
Yeah.
उसी के लिहाज से I think it has to be inculcated within the curriculum.
ठीक है.
तो ये है basic status.
करिकुलम की बात आई तो we'll be touching on the topic of medical education. You're a huge advocate of medical education. Many people know that. सबसे इसमें दो सवाल मैं आपसे करूंगा. Why do you think there is a need to stress on the field of medical education in Pakistan? And over the next, we've seen कि बहुत ज़्यादा MME programs पाकिस्तान में pop up किए हैं पिछले 4-5 सालों में. काफ़ी ज़्यादा मास्टर्स इन मेडिकल एजुकेशन यूनिवर्सिटीज़ करा रही हैं. तो इसका अगले 10 सालों में पाकिस्तान में स्कोप क्या है ऑफ मेडिकल एजुकेशन इन पाकिस्तान?
अब इसमें भी I think basically there are two contexts. First is whether you want to be, I will leave the term medical educationist, MME. I will bring it down to dental educationist. ठीक है, हम लोगों का मेडिकल एजुकेशनिस्ट वर्सेस डेंटल एजुकेशनिस्ट में there's a huge difference.
Absolutely, sir, yes.
And the difference is, if you consider especially undergrad medical studies में उनका it's basically knowledge intensive है.
Yeah.
और dentistry is skill intensive.
Skill intensive, yeah.
ठीक है. So the medical good MBBS graduate can clinically evaluate the patient well and maybe prescribe things.
Okay.
And whereas in a dentist, of course, we have already talked about and we all know about it.
Yeah.
So this is the difference. So dental education का perspective ही change हो जाता है.
Absolutely.
Having said that, a young dentist, if they want to pursue medical education program, because there's no specific dental education program, so we can call it Master of Medical Education. लेकिन कोई dentist अगर pursue कर रहा है, they have to keep this thing कि उनको skill education कैसे हम लोगों ने teach करनी है और train करनी है, उसको perspective में रखें while they're going through the medical education program. There are two career pathways. One is going full time into medical education. ठीक है. उसमें इस वक्त scope है because every college needs a medical or a dental educationist. ठीक है, dental college as well as medical college. The advantage of dentists doing medical education is that they can be inducted in a medical education department of a medical college as medical educationists as well. And of course, they can be inducted as dental educationists in a dental college. Or PMC की तरफ से, it's a mandatory requirement for all colleges to have medical/dental educationists in their colleges. तो एक तो चीज एज अ कैरियर ऑप्शन के तो फुल टाइम अगर हम मेडिकल डेंटल एजुकेशन के कर रहे हैं तो वो एक चीज आ जाती है. दूसरा ये कि इफ यू वांट टू take academics as a career, उसमें it's very important to know the ins and outs of current day, the present times medical education.
Yeah.
ठीक है कि हाउ ईच ऑफ द सबसेट्स जो कि मैंने बात की, नॉलेज स्किल्स एंड एप्टीट्यूड्स,
Yeah.
उनको कैसे टीच करना है, उनको कैसे असेस करना है, उनको कैसे इवेल्युएट करना है, कंटिन्यूइंग प्रोफेशनल डेवलपमेंट के प्रोग्राम कैसे रन करने हैं. सो इट हेल्प्स अस डिजाइन अ करिकुलम एटसेट्रा एटसेट्रा एटसेट्रा, वो सारी चीजें. Now, coming to a Master of Medical Education is good for those who want to go into as a medical educationist in a medical and dental colleges, or for postgrads who want to proceed and want to take a career in academics. उनके फ्यूचर में आपका जो कंपटीशन आना है तो उसमें बीइंग अ टीचर you would get to know how to teach better as a medical educationist once you've gone through a structured program.
Absolutely.
Having said that, for younger graduates, आप लोगों के लिए इस वक्त बहुत सारे CMEs, सर्टिफिकेट मेडिकल एजुकेशन प्रोग्राम्स आर बीइंग फ्लोटेड. उनकी वैल्यू in this competitive world आ जाती है if you want to initially work as a demonstrator. ठीक है, तो demonstrator के लिए if I have two candidates, one has a certificate in medical education, so I know okay they have basics of how to go about teaching and training. They know the structure better, so I will probably prefer them to be inducted. वो एक एडवांटेज हो जाएगा. हैविंग सेड दैट, डिमॉन्स्ट्रेटर के लिए एंटर तो हो गए, लेकिन हमारे यहाँ उसी को मेराज पकड़ ली समझ लेते हैं लोग. डिमॉन्स्ट्रेटर इज अ वेरी टेम्पररी स्टॉप गैप अरेंजमेंट एज अ यंग डेंटिस्ट. अगर आप क्लिनिकल फील्ड के डिमॉन्स्ट्रेटर हो, इट्स एन अपॉर्चुनिटी टू पॉलिश योर स्किल्स. एंड आई थिंक ए यंग ग्रेजुएट शुड अंडरस्टैंड okay, 3 to 4 years, the moment you start to feel okay, it is boredom now. It's a repetition of things every year. Move on.
Move on. I agree, sir. I agree.
Move on to become a good general dentist. I know हमारे पास demonstrators थे who actually went through rounds of being demonstrator in various departments, and they moved on and they easily passed their Canadian exams, etc., because of their experiences in each of the departments. So, or even as a general dentist in Pakistan, you can practice so much better if you have a higher skill set.
Absolutely, sir. Sir, that is a very amazing insights on medical education as a field and generally dental education. Sir, you're now the principal of FMH. It is, I'm sure, it is a it's a very busy experience that takes up a lot of your time in the day. But because you're in a decision-making chair, if there is one change that you want to see in your dental college, or one change that you would like to make in your dental college or in other dental colleges, what would that one change be?
I think dental colleges across Pakistan. Simple in one thing. I would love के हमारे young graduates are of such capability कि जिन countries में skill based licensing exams होते हैं, they should be ready to take those exams with a little training so that they get to know the system of examination there, but skill set and attitude when they should be right up there.
Perfect.
So that is one thing I would love to achieve, because unfortunately हम लोग इधर जो हमारे colleges में जो training programs चल रहे हैं, जो हम लोग 80s में हमारे जो training programs थे और आज के training programs and at most of the colleges are no different.
Sir, yes, I unfortunately have to agree with you. Except apart from yes, sir, this will be a very long discussion. Sir, let's move on from this. Sir, एक जो question जब हमने बताया that हम Dr. Abid का interview कर रहे हैं, many people asked a lot of questions, but this one question kept coming up, and especially from students of FMH. And that question was that because you're an academic, in today's day, अगर एक dentist graduate कर रहा है, what should they be looking to do? Should they be going for FCPS or should they be going for private practice right after graduation? What would your advice or what would your suggestion be to such जो इस तरह के एक dilemma में फंसा हुआ है student, fresh graduate, sorry.
देखें, दो दो चीजें। पहली चीज कि as a general dentist,
Yeah,
having graduated,
yeah,
done your BDS, finish your house job, if you want to proceed to open up your own practice, even then you have to ensure you continue to enhance your skill set.
absolutely.
ठीक है, एक तो ये चीज क्लियर होगी कि ये कोई ऐसी चीज नहीं है कि you have done your dentistry and you want to do your general practice, so I am now good enough. So मतलब कि I am picking up uh, a lot of knowledge from my students, undergrad students, my postgrad students, my colleagues, etc., etc. So all the time कोई student कोई comment कह देता है, मैं कहता हूँ wow, I have to put it into my practice. Undergrad students, even first year students.
Yeah, sir.
So your mind has to be open for to progress all the time. ठीक है, ये हो गई. Now the dilemma, where to go. ठीक है, डायलेमा है कि FCPS की तरफ जाएं, हम लोग बेसिक साइंसेस की तरफ जाएं, हम जनरल प्रैक्टिस की तरफ जाएं. एक एवरी जैसे हम लोगों ने जब ग्रेजुएट किया, we had open field, we could have gone to general dental practice, and there were not so many dentists at that time. We could have done specialization. Again, it was an open field, there were not many specialists available. ठीक है, etc., etc. तो अब dynamics have changed. First of all, you go into the path of FCPS. There are frustrations. First of all, doing the part one, then getting into a program, then going through the grinds of 4 year, or they are grinds.
Absolutely.
ठीक है, हम समझते हैं कि enter हो गए तो बस बारे न्यारे हो गए. I'm sorry.
Very competitive.
And having finished the 4 year program, comes the major. अब तक तो बिजी थे, ठीक है, अब फारिग हो गए हैं और एग्जाम देना है. और जो हाथी की दुम फंस जाती है तो कई मरतबा काफी लंबी फंस जाती है. ठीक है, फ्रस्ट्रेशन. सो वो आपको अगर FCPS के प्रोग्राम से गुजरना है तो यू हैव टू मेक श्योर कि यू आर फुली कमिटेड. ठीक है, और कमिटमेंट ऐसी कि आपने 4 साल एक जो भी एक तो स्किल सेट और नॉलेज उसको इस लेवल पे लेके जाना है कि गुड लाइकलीहुड के यू पास इन द early into your FCPS final exam.
Sir, I'm sorry. Yes, sir.
FCPS पे जाने के लिए जो इम्पोर्टेंट है आपको इस वक्त अपना आप यू शुड बी वेरी क्लियर इन योर माइंड कि व्हाट कैरियर इज इन स्टोर फॉर यू. इस वक्त फर्स्ट ऑफ ऑल एंटरिंग इनटू FCPS, or then passing it, and having passed it, what next? ठीक है, because opportunities in each of the specialty in academic institutions is relatively less now. ठीक है, lots of people are frustrated because they are not. लेकिन having said that, जो अच्छे लेवल पे ट्रेनिंग करके निकल रहा है, compassionate है, initiatives हैं, entrepreneurship है, they have places to go.
Absolutely.
And places to go. ठीक है, तो उसमें stereotypical opportunities may no longer be available for FCPS past candidates. So you have to look for opportunities which can be, again, private practice itself is a huge opportunity. ठीक है, which is इस वक्त भी आपके पास पाकिस्तान में 24-25,000 के करीब रजिस्टर्ड डेंटिस्ट हैं फॉर द होल ऑफ पॉपुलेशन. ठीक है, और उसमें मे बी अराउंड 8500 प्लस माइनस मेल डेंटिस्ट हैं, ठीक है। तो फीमेल डेंटिस्ट के लिए भी प्राइवेट प्रैक्टिस में देखें तो फीमेल डेंटिस्ट ओनली प्रैक्टिसेस बहुत ही कम है,
Yeah.
ठीक है। तो दैट इटसेल्फ इज एन अपॉर्चुनिटी। और मेल डेंटिस्ट के लिए क्योंकि दे हैव मोर रूम टू प्ले विद, दे हैव टू मूव, दे कैन मूव अराउंड टू फ्रॉम सिटी टू सिटी,
Yeah.
so
Absolutely.
they have such huge openings. Unfortunately, each one of us want to start at the level of dental professionals and think that they should earn at the level of dental professionals right from the outset. It doesn't happen.
Doesn't happen.
There are
Absolutely.
processes. You go through the process, learning a process, और इस तरीके से FCPS में आगे आपको you have to see what opportunities are available.
Yes,
The
sir.
biggest advantage of FCPS would be कि आपके skill sets बहुत बेहतर हो जाएंगे,
Yeah.
प्रॉब्लम सॉल्विंग अप्रोच बहुत अच्छी हो जाएगी। बेशक आपने एक स्पेशलिटी में किया है,
Yeah.
योर प्रॉब्लम सॉल्विंग अप्रोच की वजह से आप बाकी स्पेशलिटी को भी एज अ जनरल डेंटिस्ट के तौर पे, चूंकि लॉट्स ऑफ स्पेशलिस्ट प्रैक्टिस देयर एज जनरल डेंटिस्ट, तो
Yeah.
आप कवर भी करते हैं, ठीक
Yeah.
है। जो कि डायरेक्टली जनरल डेंटिस्ट के तौर पे कर रहे हैं, आई थिंक
Yeah.
द बेस्ट। हमारे यहाँ बहुत सारे जो हम लोग का माइंडसेट है ना, एज अ नेशन, नौकरी पेशा माइंडसेट,
Yeah.
so you have to become an entrepreneur,
Absolutely, sir.
ठीक
Absolutely.
है। And there's room for entrepreneurs across Pakistan. So जितने भी डेंटिस्ट ग्रेजुएट करके हैं, सबके लिए है,
Yeah, sir.
ठीक है। और शुरू में थोड़े से फॉर्मेटिव ईयर्स में you have to gain certain experience
Yeah.
and then intelligently move on and proceed, right?
सर बहुत आपने ये एंटरप्रेन्योरशिप का बात की सर। आखिरी दो क्वेश्चंस रह गए हमारे, देन वी विल जस्ट रैप इट अप। सर आपने बात की थी कम्युनिकेशन स्किल्स की, फिर आपने अभी बात की एंटरप्रेन्योरशिप की। डेंटिस्ट आपने ये भी बताया कि क्लिनिकल स्किल्स आर वेरी इंपॉर्टेंट, बट उसके साथ साथ सॉफ्ट स्किल्स आर आल्सो वेरी इंपॉर्टेंट फॉर अ डेंटिस्ट, सच एज कम्युनिकेशन स्किल्स, बिजनेस मैनेजमेंट स्किल्स, generally financial skills, marketing skills, if you're running a private practice। ये सब चीज़ें बड़ी इंपॉर्टेंट होती हैं, छोटी छोटी आपको पता होनी चाहिए। हाउ डू यू थिंक, इनके बारे में आपका क्या ख्याल है? हाउ टू डेवलप दीज स्किल्स इन डेंटिस्ट्स दैट आर नॉट क्लिनिकल स्किल्स, उसके अलावा जो स्किल्स है वो कैसे डेवलप करें?
In an ideal world, we should have all of these inculcated in our undergrad training program,
Absolutely, sir. Yes, I
ठीक
agree.
है। However,
Yeah.
ours is a 4-year dentistry training program,
Yeah.
ठीक है। ऑल्दो अमेरिका में भी 4-year dentistry program होता है, but they go through a 4-year bachelor's program
Only
before
bachelor
coming into a
program.
dentistry program. So lots of, जो basic knowledge of physiology, anatomy, etc., 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 they've already caught up.
Got up.
So they have more time at hand
Yeah.
to refine those areas,
Yeah.
ठीक है। सो वो चीजें जो हैं उसके लिए, एक तो ये कि लाइक इन इन सॉफ्ट स्किल्स, स्पेशली बिजनेस मैनेजमेंट स्किल्स के लिए दे वुड, आई थिंक आपको खुद इनिशिएटिव लेना पड़ेगा पाकिस्तान में राइट नाउ।
Yeah.
आई डोंट फोरसी, अनलेस वी मेक इट अ 5-year program,
Yeah.
I don't foresee introducing structured program for business,
Management.
financial skills, entrepreneurship, etc.
Yeah.
5 year करने में उसकी फाइनेंशियल इम्प्लीकेशंस आ जाती हैं,
Absolutely.
पब्लिक सेक्टर इंस्टीट्यूशंस में भी आ जाती हैं और प्राइवेट सेक्टर में भी आ जाती हैं। पब्लिक सेक्टर, प्राइवेट सेक्टर में तो फीस के कॉन्टेक्स्ट में भी आ जाती हैं, और पब्लिक सेक्टर में अगेन, और दूसरा पब्लिक एंड प्राइवेट सेक्टर दोनों में, फॉर द ग्रेजुएट्स टू स्टार्ट टू अर्न,
Yeah.
की जो टाइमलाइंस हैं, some of less privileged young dentists may not have the cushion of, like they have to start early to earn,
Yeah.
ठीक है। तो वो एलिमेंट आ जाता है। So effectively you have to be on a lookout for such programs.
Programs that can
I
help.
would like to encourage all the institutions to, especially during the house job, उसके continuing professional development programs with regards to business entrepreneurship, फाइनेंशियल मैनेजमेंट स्किल्स, एटसेट्रा एटसेट्रा, इसकी वर्कशॉप, इसके सेमिनार्स एटसेट्रा जो कि इंस्टीट्यूशन में कंडक्ट किए जाएं.
Institutions में
So I
conduct.
think that is an important context. इस
Absolutely.
वक्त probably that is the best option we have.
Best option we have. Sir, second last question to you. छोटा सा क्वेश्चन है. If someone like me, like many fresh graduates out there या final year में house job में है, जो एक fresh dentist 2023 में निकल रहा है, उसको आप क्या advice करेंगे कि उसका mindset क्या होना चाहिए young dentist का to grow in the next 10 years? Mindset क्या होना चाहिए उस dentist का?
देखें, वो अगले 10 साल तो बाद में आते हैं.
Absolutely.
ठीक है. A bird in hand
Yeah,
is better than two in the bush.
absolutely.
हमें बड़ी फ्रस्ट्रेशन होती है.
Yes.
ठीक है. Because we go there those extra miles
Yeah.
to provide opportunities for students,
Mm-hmm.
and we get really frustrated when the students उसको बड़ा एक कर्ज की नजर रख के कहते हैं ओ हमारे ऊपर बर्डन नहीं पड़ रहा.
Yeah.
ठीक है. The opportunities we are trying to create during studentship and house jobs,
Yeah.
at least what I'm trying to create और हमारी टीम जो create कर रही है फातिमा मोरिल में, these are the opportunities which we missed out on.
Absolutely. Yeah.
ठीक है. So we would like you people, the
Yeah.
young graduates, to be so much better than us
Yeah.
when they go out in the real world.
Absolutely.
ये पहली चीज तो ये.
Yeah.
So first and foremost is जो पहले भी कहा, skill set until you get to the exit of your house job, then become a during the studentship and house job as well, but more so afterwards to become a self-directed learner.
Learner.
And what do we mean by self-directed learner?
You said this you
Self-directed.
said this at the panel discussion as well, sir. I remember you mentioned about this. You talked about this. Yes,
So
absolutely.
self-directed learner is an individual who constantly evaluates oneself, identify the shortcomings. Having identified, they move on to find ways or resources जिसके जरिए वो शॉर्टकमिंग्स को प्लग कर सकता है. वो शॉर्टकमिंग्स आजकल के दौर में प्लग करने के लिए यू ओनली नीड योर पाम.
Yeah.
यू नो व्हाट आई मीन.
Yes.
ठीक है. Having done that, then further identify, nahi, I've gotten here but I have to get there.
Yeah.
अब जो further gap है, you need to seek help.
Constant.
Identify that individual.
Yeah.
Go out. आपके अपने टीचर्स हैं, दूसरी इंस्टीट्यूशंस हैं. Go out, find them, seek them, ask for help. Let me assure you that any good teacher
Yeah.
will always be there to help
Ab-
you people out.
Absolutely, sir. ये तो I 100% agree with
So
you.
this is the attitude if you go in to professional life along with entrepreneurship mindset.
Yeah.
ठीक है. तो अगले 10 years में progressively you will develop further and further.
Perfect, sir. That is a beautiful answer. I've interviewed a lot of people and I've gotten some very good answers, but this is one of the best answers I've ever gotten on the mindset of what the mindset of a young dentist should be. With that, sir, thank you so much. Our last question to you: what do you think about this platform of ours, the Dental Talk, and any advice or suggestions that you would like to give to me and my team? Any?
I think it's a great initiative. I admire entrepreneurship, as I've already said,
Yes, sir.
and this is one area of entrepreneurship.
Absolutely.
और these things, you know, हमारे पास बहुत सारे अब मीडिया में भी अपॉर्चुनिटीज आ रही हैं.
Yes, sir.
यही जो स्किल सेट है, यू कैन टेक इट टू द नेक्स्ट लेवल एज अ स्टार्टअप. ठीक
Absolutely.
है. बहुत सारे स्टार्टअप्स आपके मीडिया के हैं, मार्केटिंग के हैं. What you're doing right now, you can take it further as a startup for media and communications in dentistry, private practice, marketing and all that. और ये innovations है ना,
Yes, sir.
तो फिर आपको you do not get stale.
Wow, sir. I wish I could sit with you one day and talk to you in person because मेरी और आपकी सोच बहुत मेरी बिल्कुल आपकी जैसी आप मेरी बिल्कुल आपकी जैसी सोच है because the media and marketing thing that is an idea that has come to me before as well. So thank you so much, sir. It feels really nice to talk to someone who I can relate to.
You're welcome.
Chale sir, with that, thank you so much once again for taking time out. You have to get to a surgery, and I'm sure सबको बहुत अच्छा लगेगा interview. So many people have asked me to bring you onto the show. Once again, sir, thank you so much and take care.
चलिए, thank you very much and all the best to all the audience.
Thank you.
Good luck and best wishes. Thank you.